Welcome back to What's Next Longevity Deal Talk. We have a great lineup you don't want to miss, featuring news from Equitage Ventures, Get Set Up, and Ursantis. This episode is made possible by AMBA.
Hello, I'm Stuart Hamilton, the founder and CEO of AMBA. We empower caregivers to provide the best possible care by gathering information passively as your residents go about their daily and nightly routines. No cameras, no wearables, no buttons are needed. We use this data to provide caregivers with timely alerts and insights, enabling them to deliver the right interventions to the right residents at the right time. One of our newest clients has just reported a range of benefits, including a 53% reduction in falls in the first month. I'd like you to hear from them.
I didn't choose this career, it chose me. I took a summer job with my aunt in a small community, and a nurse there, she was like, "You have a knack for this." Our challenge in the community and any community right now is staffing. We need the right staff. Beforehand, it was just us doing our regular rounds, walking in on residents, possibly on the floor. We get those alerts with those residents who are either exit seeking or have high fall risk. It gives an alert to the phones to give us an opportunity to get to them in time.
It was harder when you didn't have all the facts. If I know that you're getting up at night, if I know you don't sleep well, we can program our care plan around that information.
It's that invisible eye. It allows you to know that there's activity going on. AMBA allows us to be able to pull that activity and identify the problem to where we can pinpoint that down, and we can look at the medications and make the proper adjustments to be able to offer the AMBA system to them and explain to them how safe we can keep their family member has been such a huge plus.
It takes a resident seconds to fall. And so once we get that alert, we're immediately on it. And so we can almost get there just in the nick of time or right before. It's a great addition to any building, and we're glad to have it.
The AMBA system has definitely changed the way I think about marketing. We can promise a lot of things, but to add examples and to be able to show data, it's perfect.
If you're in the business of providing care, we would love to help you. You can find out about us and learn more at amberhealth.com.
I'm Fred Fishkin, along with Mary Furlong. Hi, Mary.
Hi, Fred. We have a lot to get to today. First up, we want to welcome Danny Kaplan from Equitage Ventures. Hi, Danny. I've known you a long time, and you have big news today.
Thanks for having me, Mary. It's a pleasure to be here. And I'm happy to share more. The news is that we are officially announcing our first fund at Equitage. Equitage stands for Health, Equity, and Age. And we are about a $47 million venture capital fund, hyper-focused at the intersection of senior care, tech, and healthy aging. We raised the majority of our capital from a purpose-built group of LPs, so investors kind of spanning the senior care world, the healthcare world, and the long-term care world. And our purpose and mission is to be more than capital to both our LPs and to the founders who we back. So really excited to announce it and excited to be here and share more.
Maybe you can share a little bit of your background, Danny, for folks too, besides that of Equitage.
Yeah, absolutely. So I have been working, in this age tech world for about 13 years. More importantly, my dad was 58 when I was born. So senior care and aging have been a part of my life for my whole life. In 2013, I worked at a company that made web-based software for home care agencies. I was employee number 13, grew with them to 120 people, did everything from customer support, customer success, account management, business operations, and really kind of worked in every capacity of that business. After that business was acquired by the private equity arm of Battery Ventures, I found my way to USC, where I got an MBA and an MS in gerontology. Actually, my first day of gero classes at SC, I just opened my gero textbook to just a random page, and there was actually an excerpt in like on that page written by Mary, actually, which is very cool. I was
Wow.
like, wait, I think I know that. I think I know her. Yeah, so while I was at SC, I got put in touch with the folks at Generator Ventures, which is the first and longest established kind of age tech venture capital fund, co-founded by Katie Fike and Arnie Whitman and Russell Hirsch. And I was fortunate enough to work with them and learn from them throughout my time at SC. And then for about 3 or 4 years thereafter, I helped them invest the majority of their fund one. I backed them up on a bunch of boards, and then left about 2.5 years ago to focus solely on Equitage. Started our fundraise January of 23, and then officially announced the fund one just today.
And what's the size of the fund and what level of investment will you make?
So the size of the fund is specifically it's 47.3 million. And we're going to be looking at primarily kind of seed and Series A stage companies, both in just the pure play tech and tech-enabled services world. Companies focused on improving quality of care and quality of life for older adults. I like to say you can think of it as kind of like a healthcare fund or a digital health fund focused not exclusively and not together, but almost separate and together, both senior care, so the medical side of things, and aging, the more social and life course side of things. So seed checks looking at targeting probably $250,000 to $500,000 checks, and Series A checks looking at probably 2 to 2.5 million in initial checks, and look to deploy a total of probably 4 or so million into each company over the life of our relationship with that company. So I had said kind of seed and Series A stage. One of the interesting things about investing right now, AI aside and value-based care aside, and all these other buzzwords aside, is that there are some really incredible later stage companies that are out there that are at pretty attractive valuations, I would say, relative to the amount of traction that they have, the amount of evidence or data that they have, the maturity of the overall business, and comparing a valuation of, say, a Series B or a Series C stage company to that of a hot seed or Series A stage company. There's sometimes they're not that much different. So while I can't promise exactly the check size or exactly the kinds of companies, I would love to get some capital to work at in a later stage company. Call it a Series B, Series C, Series D. I don't need to own 10% of the company. I don't need to own 5. I just want to co-invest with great people and back great people. So, I'd like to think that the majority of our deals are going to be seed and Series A, and probably do a handful, maybe 1 or 2 of later stage deals as appropriate.
And of course, you have this strong background in home care, so you can bridge solutions for senior housing and home care. Right.
Absolutely. Yeah. Yeah. No, look, I would say that what's interesting kind of about home care is that home care, just how senior housing is, these businesses are private pay businesses today, but they're very much doing healthcare stuff, right? And that's exciting because healthcare stuff, it moves the needle, and for the most part, a lot of it is actually reimbursable. And so we see opportunity kind of building the translation layer between non-medical provider types and care settings like non-medical in-home care and senior living, and building a translation layer via either data and or services between that and the healthcare system.
Daniel, any other thoughts about the market today and the opportunities that are out there?
Yeah, I wouldn't be doing my job as a venture capitalist on a podcast if I didn't talk about AI. I'd say that we're seeing a lot in AI, and it's really exciting. it's also making our jobs really difficult. Barriers to entry for AI are seemingly dropping by the day. It's becoming cheaper and more capital efficient to build an AI company. To be honest, it feels like every single day you're seeing new ones pop up. What makes our job difficult is because there's so many companies popping up. You might talk to one company building a unique product in a unique space. You meet with them and you just have your mind blown in the best way possible. Maybe 3 or 4 weeks later, you blink and you say, wow, I've just talked to 3 or 4 companies that do seemingly the exact same thing. So who's going to win? One. Two, who's going to win when the barriers to entry are seemingly so low that there's a bunch of companies kind of all doing the same thing and all these things are amazing? And three, what does it mean for incumbents, right? Like, the big kind of behemoth like software companies in this space who would be ideal acquirers of these businesses, right? I mean, the barriers to entry were dropped for early stage companies and early stage founders, but they were dropped for incumbents too, right? And so even though incumbents have red tape and budget meetings and tech debt and all that stuff, they might not be able to move as fast as an early stage company, but they can still move, and some can move with relative speed. And so figuring out kind of, is this a team that has the secret sauce in terms of knowing what the customer wants and what the customer needs? Trying to figure that out is difficult. I actually think that at Equitage, we're relatively uniquely positioned to suss that out, particularly through our diligence process, because we have the backing of, senior living operators, skilled nursing operators, home health, home care, health systems, et cetera. I've kind of been thinking like the companies that are going to win in this space, a lot of the principles that won in SaaS, I think will carry over to AI, right? How well do you know the workflow of your customer? What's your price point? What's your ease of use? Stuff outside of SaaS being, of course, like, are you creating a proprietary data lake that you can use to better train and fine tune your models, right? That no one else can actually do, right? That's kind of more AI specific than just SaaS. But that aside, like I'm thinking that, when we meet companies, we really want to validate, like, are they working on something amazing, and are they really uniquely, truly solving a customer's pain point? Being able to get them in front of their prospective customer is a great way to help answer a question like that. And so that makes me really excited that even though we're faced with this kind of sea of companies, our ability to really run a thorough diligence process, I think is going to be very, very real, because we can get them in front of customers and just go on mute and listen and see how that call goes. And so that's something that I'm very excited to be able to do.
I would imagine everybody's got the AI. So you're looking at, I would think, the people who are involved in using these tools, and really you're investing in the people, right?
We're totally investing in people. That's the number one thing, right? I think a good team can take a mediocre idea and build a really special company, and a bad team can take, a moonshot idea and something that's amazing and really drive it into the ground, right? At the end of the day, we don't invest in early stage companies, we invest in early stage teams. That's literally the most important thing. I think back to when we were doing our fundraise, right? Like, people's eyes kind of glazed over when 10,000 people turn 65 every day, and the Medicare budget's going from 1 trillion to 2, right? You can throw these numbers and all these stats and tell them about how amazing this market is, but almost everyone, they didn't invest in Equitage Ventures. They invested in me and Russell and Adam, my 2 partners, right? And so that's kind of the same lens that we have to take here. And I think also when you're looking at AI companies, you really want to spend time with companies and look at companies that again, like, have spent a lot of time with their customers or with the end user, and have a really deep understanding of the operations and the workflows of their users, so they can solve those problems or address those opportunities in really unique ways, right? I think in the past, you might have some product people, some VCs, and an engineer in a room, and they're almost telling the market what they need, right? Here, like I want to invest in companies who are building products alongside their customers, and that's something that I think we can help with.
Absolutely. You bring a lot to the table as the partners. And so tell us the names of your other partners.
Yeah, so names of my other partners. So we've got Russell Hirsch, who's been in biotech and med device venture and general kind of healthcare tech and services venture for 34 years. MD, PhD, founded a biotech company in the early 90s, went to work for Mayfield, started his own couple kind of biotech and med device dedicated funds. And then I met him shortly after Russell, Arnie, and Katie had closed the Generator Ventures Fund 1. Russell's a lot more than just a business partner to me. He's also a friend and a mentor. And then my other partner is Adam Kaplan. No relation to me. He is the founder and CEO of Solera Senior Living. They are a ultra high-end kind of integrated developer, investor, owner, operator of kind of very high-end senior living, so IL, AL, and memory care. To date, I think they have 15 or 16 buildings, high barrier to entry markets. He's developed, I want to say 7 or 8 buildings to date. And when you go into Adam's buildings, it's really special. I've been to, I want to say 3 or 4 of them with Adam. He knows the names of the EDs. He knows the names of the kitchen staff. He knows the names of the staff. He knows the name of the housekeeping staff. He knows his residents' names. Just walking around there, it's really special. And he's very forward thinking and progressive when it comes to thinking about integrating tech into his operations and integrating healthcare services, into the senior living world. Not to mention, like at his core, Adam is an entrepreneur, and that's really exciting, right? I mean, he started this company from nothing. He's got 2,000 people plus on his payroll. He's got 2,000 plus residents. Like he's really built this into something special, and it's still early in the game. So I'm really fortunate to be on a founding team of a venture fund where we are different people. There is no such thing as groupthink in our partnership. And I get to learn from these guys every single day.
No, I know all 3 of you, and I think it's an amazing team. Danny, thank you for spending so much time with us today.
Thanks for having me.
For more information.
Yeah, so 2 things. So one, please go to our website. It's equitagevc.com. That's EQUITAGE VC.com, equitagevc.com. And you'll see kind of halfway down our homepage, there's a link to sign up for our newsletter. We put a newsletter out at the end of every single month, last business day of every month. And we break it down what we're learning. So what we learn in that month and what are we reading? And we break that down by policy, industry news, and general good reads. So thanks so much for having me on here. I really appreciate it.
And we like it on your breaking news day. And we appreciate you coming back as a judge this year. So
yeah, of course.
You at the Longevity Venture Summit.
Excited to be there.
Mary, our next guest is John Ralston, the CEO and founder of Neursantis, Neursantis. Great to see you again, John.
Thank you very much, Fred. Good to see you again, Mary.
And you're on Deal Talk because you've got some news to announce that recently made some headlines, some partnerships that you undertook, and some success stories.
Yes, we are very excited to share that we've recently completed a very successful pilot deployment of our bioelectronic balance restoration device in a partnership with an at-home care provider in Silicon Valley, Caring Hands Caregivers. We trained their team how to use the device to provide our 6-week therapy, and then enrolled a cohort of seniors from the forum at Rancho San Antonio, continuing care retirement community in Cupertino, California. They came to the clinic 3 times a week for 6 weeks, a 20-minute balance treatment each session. We tested their balance before the treatment began, and then 6 weeks later, and the improvements in their balance mobility, both as we measure with our instruments and their self-reported improvements in balance mobility, were truly dramatic, which really underpins the transformational quality of life improvements that we're able to deliver with this technology.
Just
And
describe,
not just in the lab, but out in the wild where we really want to take it to market.
what's the brief description of what your technology is and how it works?
So the device that we have, and you can see it hovering over my shoulder here, our Nervesta device, is designed to help older populations to continue living more actively, independently, and productively by delivering what we call bioelectronic restoration of the body's aging balance system. So the device delivers a very unique form of non-invasive electrical stimulation that we've developed to the vestibular balance organs in our ear. That's been shown to activate very long-lasting neuroplastic restoration of the balance mobility that's been proven effective now in study populations from 50 to 90 years of age.
That's amazing. Of course, the forum has such a great reputation, and a lot of what we like to show at our conference and on our podcast is how you can go to market in senior housing and in home care. And this is the future. So we want to evangelize this and tell everyone about it. Our Rolodex is yours, and congratulations to all you're doing, John.
Well, and hats off to communities like the forum, whose residents are so innovation friendly and are willing to embrace and take for a test drive a solution like ours.
That's
Mary,
great.
we'd be remiss in not pointing out that John was the winner in your 2022 business plan competition. So you were on this early.
And also went back 2 years later and won the ARP Tech competition. So congratulations. It's been a journey that's fun to follow, but it's a huge market ahead, and we've got to get more pilots out there. So we'll be telling people about that.
Yeah, we look forward to seeing all of you at the Longevity Summit this June in Berkeley.
And John, for more information, if people have questions or maybe want to learn more about what you're doing, maybe take advantage of it, where's the best place to go?
Please reach out directly. If you go to our website, there's an information button you can click to send us an email or ping me directly. It's just my first name, John, dot last name, Ralston, Ralston, at nersantis.com.
Mary, our next guest, Neil D'Souza, is an entrepreneur who has been finding ways to use technology to improve the lives of many through the groundbreaking platform Get Set Up. Hi, Neil.
Hi, Fred. Hi, Mary.
We so appreciate you making time in your schedule to be with us, Neil. We've been following Get Set Up pretty much from the beginning, as you know, and what you and Lawrence have created is really an important platform for learning and providing opportunities for teaching. And it's really changes by the quarter. It's empowered so many people. So tell us more about what the numbers look like today.
Yeah, no, it's been an interesting journey just building Get Set Up and going through all the waves, both in terms of how the world has changed, how more and more older adults, or like we call them active agers, their needs have changed and they become more technology competent, right? So I think last year we wrapped up with close to about 2.5 million members actively participating in classes, different types of classes, over 5,000 plus topics. We have over 100 plus partners, which are from the public sector, and some insurance companies that offer our program and our platform to their members. And so that has grown quite a bit for us. We also have scaled up what we call our embeds. So this is where rather than members and older adults coming to get set up. We actually empower like platforms like AOL or other sources where their members can take get set up classes and activities on those platforms. So on those fronts, like we've seen that the demand for it grow, and we're seeing more and more healthcare companies actually now interested in deploying something similar on their platforms.
So you really moved the needle on health literacy, digital literacy, AI, and older adults' understanding of AI. But you posted this amazing blog post this month, and I reached out to you after reading it on LinkedIn after you attended the World Economic Forum in Hong Kong. You talk about the urgency of rethinking how we fund and scale innovations to support the aging population globally. So let's dive into that and do a reprise of what you said in the blog post.
No, yeah, so I actually was fortunate to attend a World Economic Forum event in Hong Kong a couple of weeks ago, and that was an interesting gathering of about 150 CEOs in the finance space, but also in the longevity space. And so what was really interesting is to see how two different stakeholders, one was thinking about how to finance this aging population as they're living longer and their healthcare costs go up, and they haven't planned for that additional 20 years that people might live. What do you do there? And the other stakeholders were people thinking about how to support people who are aging, right? So companies that have a base that is going to retire, like what can they do, which is basically insurance companies, to take preventative action so that members who are retiring today can live a healthy life so that the cost to the financial system is not so much and it doesn't become a crisis. So it was interesting to actually have two of these different stakeholders talk about what data they are seeing. And sort of my takeaway there was that, this is a bigger crisis than we think about or talk about, right? Like you want to live longer, and so we have one group of people who are trying to hack longevity and come up with better drugs and processes and procedures to get us to live longer. But at the same time, no one's really thinking about how you're going to finance that second life, how you're going to actually make it more meaningful for people, and what kind of system do we need to do that. I got to talk a little bit about sort of the three stakeholders there, Mary. So we all obsess about innovation. Like Get Set Up is also, I think, an innovation in how these programs used to be deployed in the past. But we have three stakeholders, right? When we talk about the aging population, stakeholder one is the beneficiaries themselves, so older adults. Now, they are not the first to lap onto any new innovation. It's not because they don't know, they don't have the means. It's just they don't trust it, right? Because you need enough trust and credibility to show that something out there is going to work, because the world is sort of inundated with new and new innovations every day. And so you have this beneficiary whose rate of adopting innovation is I would say pretty slow, and for all the right reasons. You have the second stakeholder who are the payers, who pays for these innovations, right? Like if you want to live longer, mostly the payers are public sector. So whether it's in the US, it also comes through Health and Human Services, even if it's a private insurance company. And if it's in other markets like Singapore and Hong Kong and China, it is the public sector. So the payer for anything to do with this age group generally happens to be the public sector. And then you have the third stakeholder, which is really cool, which is all the venture guys. Now, as you know, venture funds have a 7-year window of funding innovation. They want to either exit within 7 years, they want you to grow in a rate that is, like commensurate with certain consumer brands, but they have a short lifespan, right? Their window is 7 years. And so you have these three different stakeholders there, all trying to drive innovation, fund innovation, pay for innovation, or adopt innovation. And they're all three on very different clocks and three different incentives.
Can you name some of the stakeholders that you met and you saw at the table, or is it private?
I don't think I can mention all the names, but there were like some folks over there were, from Franklin Templeton, thinking about retirement, Marsh, McLennan, Mercer, they actually provide a lot of consulting and insurance related services to corporates in Asia. So, and there were several other from China that were there, and
And
Hong Kong who
sovereign-
are thinking about it.
And aren't family offices and sovereign wealth funds coming into the picture?
They do. So they were also part of it. I think they were looking at it from the lens of, again, how do you finance people, this aging population and their needs, especially as they live longer. And so they were part of that forum, just trying to think through how to finance it.
Because your members are getting healthier in the Get Set Up platform. They're taking positive changes. So that's good for a health insurance company, right?
Yeah, it's good for a health insurance company, but it also means they're going to live longer,
Mhm.
which means someone has to provide pensions for them longer.
Right.
And all of the social security longer, which they haven't planned for.
Globally, a lot of that is public sector, right?
Everywhere, right? Even in the US, in some form, it's social security or it's health and human services that allocates, I think, around $14,000 per individual for their healthcare, right? United Healthcare or Aetna might manage it, but it is still coming from the same pool. So everywhere, I think it is the public sector that finances basically, cost of care.
In your post, you were advocating for a blended kind of funding approach. You talk about public and private. Are there any examples that come to mind of how that can work?
Yeah, so the reason, we had a lot of discussion on this topic, and it was going back to my earlier thoughts about the three different stakeholders, right? There's so much mismatch in either adoption rate, the exit expectation, and the payer, how they pay once they have seen something work, that usually startups end up failing, right? So most innovations that might be actually good don't survive because they all are on very three different clocks. And so when we had this discussion about blended financing, it really came down to um, who should come in and actually fund the innovation to get it from an idea to a completely de-risk state, right? So fund the R&D, fund the research, fund the testing of it. And then when it's ready to scale, that's when like you get a blend of private equity or venture investors come in to actually help do what they know doing well, which is scaling it. And doing that in conjunction with public sector. And so a really good example actually is the NIA, right, in the US, which I think in most other countries we don't have it, but NIA has a really good program for like small business grants where a lot of innovation in other spaces like Alzheimer's research and all, where a venture person will never come in to fund it. So the government, which is the public sector through NIA, actually takes on that responsibility of funding the innovation, funding the research, till you can hit a point where a venture person comes in. So it's not very commonly known, and even globally, people don't know about these programs, but actually we've done a pretty good job here in the US to build a system like that. But that's what we were talking about, right? Like you do need this public-private partnership in funding it because the private guys are not incentivized to wait for 10 years or 15 years or 20 years for exits, and the public sector needs innovation, but they can't individually go into fund companies because they don't have the bandwidth to look at like $2 million, $3 million checks. So how do you actually bring together those two to fund innovation, but at the same time be patient?
Well, that's sort of a very exciting confab of people with all the right people in the room, and great place for you to share your story. So there seems to be so much economic uncertainty today, even when it comes to Social Security here in the US. What are your thoughts about the current events at a time when you're saying every country must rethink how to invest in longevity?
Yeah, look, I think Social Security is an important program. I think every country has some version of it. think there's a lot of, I think where Get Set Up comes in is we try to do our best to educate people in using it and accessing it, being able to utilize it more efficiently. But it is an important program. I think you can't do without it, but it does need to. I think we do need to look at it differently. Like maybe that itself needs a little bit of innovation. Because again, like I said, if we have to fund a healthier life of somebody who is actually doing all the right things now and living 20 years longer, like is the way social security is set up today the right way to fund something that someone has retired at 65? We don't have the answers. I think this was the big question. um, Even several European funds were asking family offices and pension funds that, hey, we have visibility for 20, 30 years, but if people live longer, we don't know how we're going to fund this, right? So I think it is the system itself of social security, I think, needs to be reimagined and rethought because it is absolutely needed. But how do you make that dollars go and last longer so that we can fund all the healthier aging population? That's a big question mark. And I think someone needs to go and we need a bigger group of people to come and think about it and brainstorm on this topic.
Well, Get Set Up, for instance, encourages lifelong learning, perhaps even helping people continue to earn going forward. And how significant a part of a solution could that be to this puzzle?
Yeah, no, actually, that was another topic that uh, people were talking about is how do you keep I mean, that's one way to solve it, right? Like people keep earning as they live longer. And a big part of the event was AI and what AI is doing to the economy and, will it take away jobs? But surprisingly, we actually think that uh, as you get older and AI gets better, you'll actually see a lot more opportunity for the aging population to earn more money because um, the older adults actually have the skills and the knowledge and domain expertise, and they can actually be paired with AIs to actually solve certain problems that someone much younger might not be able to because they don't have domain expertise. And so really one of the interesting topics was that, which is how do you keep someone who's turned 60 and 70 be more productive, right? Maybe not go back into the workforce because that's not really like practical, to be honest, but like how do you make them into entrepreneurs so that they can earn an extra living, contribute back into it, and are not that dependent on a lot of social programs. So actually AI, the way AI is developing, I think poses a really great opportunity to like, so for example, Mary, you could have your own AI agent and launch several businesses because you know so much about so many topics, right?
Well,
That was
thank
not possible 5 years ago because you would have to build a whole team, and the cost would be so much, right? And I think with AI, you could just tell it what you want and it will go build it for you. So that
yeah,
creates an exciting market.
I like the idea of thinking about older adults as part of the gig economy and where they develop new skills like they're learning on the Get Set Up platform. And then they're also learning the use of AI. It keeps them relevant no matter what job they go into. A lot of people do want to work part-time. Everyone that's shocked by the market today is looking for a gig to help them continue to earn income because so much of their nest egg has been tied up in the stock market or in their retirement accounts. So I think this is a very encouraging sign to think about the future of economic opportunities of older adults participating in the economy as stakeholders. And I did find it useful yesterday. I did use it to help me. I know I was using an AI chatbot when I was trying to pay my property taxes. So
Oh, nice.
I could tell, but we're just getting, what I like about the platform that you have is it makes it easy to learn these new skills. But
Yeah.
thank you for giving us a view into the World Economic Forum conference and all the stakeholders that were there, because we need those stakeholders to open up the questions and help carve out some of the answers, because it really is a global opportunity. It's not just a crisis, it's an opportunity for innovators, for investors, for governments to innovate. And you were absolutely right to call out NIA and their great work. So, Neil, your thought leadership continues to be so valuable. Congratulations to the work that you and the team at Get Set Up are doing. And thank you again for joining us today.
Thank you, Mary. Thanks, Fred. Yeah.
Before we wrap up, there are some other Deal Talk headlines to highlight from your latest newsletter. Two at-home hospital providers, Denver-based Dispatch Health and Boston-based Medically Home, merged to expand their range of services and care across multiple metropolitan regions.
And Lark Health, an AI-enabled management and chronic disease prevention platform, partnered with CVS Caremark to expand access to their cardiometabolic care programs. And Character Biosciences, a precision medicine company, secured $93 million in Series B financing to support clinical trials addressing age-related macular degeneration.
Restore 3D, a 3D printed orthopedic implant care company focused on joint replacements, raised $38 million in funding, while health tech company Inspirin secured $35 million in funding for its AI-powered senior living solutions.
And BrainSpace, which makes Brain Sensei headset to determine cognitive health, raised $11 million in Series A funding.
Mary, that will do it for this episode.
Lots of news and great information. And we want to remind everyone about the upcoming Longevity Venture Summit in Berkeley on June 10th and 11th. It is co-hosted by the Age Tech Collaborative from ARP. We have an amazing agenda planned with great speakers, lots of investors. Once again, our $10,000 business plan competition and the 2025 John Hopper Leadership Award.
And the place to go for more info and to register is longevityventuresummit.com. We want to thank our guests for taking time with us and also our sponsor, AMBA, providing technology to enable responsive, personalized, and effective care. Discover how AMBA can benefit your facility, your residents, their families, and caregivers. Find more at ambahealth.com. We thank you for taking the time to watch or listen. Remember, you can always find us at maryfurlong.com/podcasts.